So good afternoon, everyone. I'm Vanessa Durantis, the Commissioner of the Connecticut Department of Children and Families, and we welcome you to the Family First Prevention Services Act Prevention Plan relaunch. As Connecticut's Department of Children and Families recognizes that we are a part of the full child welfare system, we'd like to thank all of you for joining us this afternoon for this to be one of the most engaging conversations that you've had in the last 6 months. I want to start by just saying thank you. You know, I've said many times before that relationships are built before the house is on fire. And if this pandemic hasn't shown us anything else, it has taught us that these relationships are strengthened as we continue to work together to support children, youth, families, and communities in a time of sheer and utter crisis. There are so many lessons learned. Like within many relationships, our system is far from perfect. It is the illumination of these gaps and holes and inequalities that persist that will further galvanize our family first work together. So I'd like to thank you all for joining us this afternoon. I'd like to thank all of our co-leads who have been shepherding us through from before the pandemic. They have been staying right with us in terms of our communication and conversation as we have tried to navigate this crisis together. I'd like to thank our consultants with Chapin Hall for kind of sticking with us and patiently waiting as we figure out what the next steps were. So at the same time that the state was shutting down in the spring, Ken and Joshonda, who were just the dynamic duo behind all of Connecticut's Family First planning work, made the decision to recommend that we pause the prevention plan development so you could all attend to the urgency of the moment. We find ourselves at a critical impasse as we navigate this pandemic, working towards the recovery, but most importantly, building the system for Connecticut's children, families, and communities to thrive. To get to that, we have to ask ourselves a few questions. Who has been left behind? Who has suffered losses? You know, one of the things that I think about is one of the leaders in our Child First work and our community partners is Beresford Wilson, who tragically lost his son over the last 6 months. As we extend our sympathy to him and to anyone else who has experienced a loss, we also recognize that there are tremendous losses from the coronavirus and by several other means during this time. What does all of that mean to our system? What can our system do without? What does our system need? What does it not currently have? What's working well? What can we figure out how to get more of? What don't we need to continue doing? And what is it that will get us to the values and results that we say that we seek? So today, I welcome you on behalf of the department, but also into the Family First relaunch, understanding that all of us, most of us on this call, recognize that we've never stopped, that this crisis has brought about the strength of a system that we knew existed, but more importantly, it has energized us to recognize this work is more important than ever. So I thank you all for joining us, and I recognize that at the same time that we are all balancing the mission critical work that we all espouse to do, that we're also balancing our own health and safety needs of our own families and that of our workforce and those of the children and families that we support through all of this crisis. So with that, I turn you over to the half of our dynamic duo, and that is our Bureau Chief of External Affairs, Ken Meiser, to take you through what will be an incredible afternoon of planning, reflection, and moving forward.
Awesome. Well, thank you so very much, Commissioner Durantis, for those opening remarks. As usual, engaging and getting us off to a great start. Joanna, if you could just go back one slide. There you go, right there to the relaunch objectives. So first and foremost, welcome to everybody here. I think we're approaching 300 people on this call, which is tremendous. Let us kind of quickly walk you through what we wanted to do today and some of the individuals who are going to be speaking. So first of all, we obviously had our commissioners welcome. We're going to have Michael Williams, our Deputy Commissioner, speak in a few moments about prevention and what's happening nationally and what are we seeing in other states and what is the national movement that in fact is in part informing Connecticut, and to be honest, in part Connecticut is forming other states and the rest of the country. I'm going to give an overview of Connecticut's perspective and taking it from really the lens of what are our lessons learned from our initial Family First work to how the pandemic has influenced our work, how our social unrest in our communities has widened our scope of the urgency to do better for children and families. We're then going to have Joshonda Gurrier, my fantastic partner in our co-lead for our Family First work, is going to lead facilitated conversations where one of the co-leads from each of the work groups is going to walk you through their accomplishments and then very specifically what the next steps are to the development of a Family First prevention plan from their individual responsibilities. Then we're going to talk about planning forward. We're going to hear from our partners, Miranda Lynch and Olivia Wilkes from Chapin Hall. And then we're going to wrap up with a quick discussion of what it is that we think you can do to continue to stay involved and be as updated as you can be with our department. So we welcome you. We are so happy that you've been able to take the time out of all of your busy schedules to be with us virtually. And let's get started. So at this time, we would like Michael Williams, our Deputy Commissioner of Operations, to talk about the national perspective.
Good afternoon, and thanks, Ken, and thanks, Commissioner, for opening us up, and thanks to all who have joined us for this relaunch to get our efforts of planning resumed. I too have to really thank Ken Meiser and Joshonda Gurrier for their outstanding leadership for the Department of Children and Families to move us towards a successful implementation, not a successful development of a Family First plan to submit for implementation. Without them, we wouldn't be where we are today, along with all of our co-chairs and our technical supports from Chapin Hall. So I really appreciate it, and I view this as a very exciting day. Like most of you, I was saddened by the fact that we had to have a pause in our work. If you all remember, our ambitious plan for Connecticut was to have a plan already before the federal government for approval by October 1st, which is 2 days from now. So that's where we thought we would be, ready to start our Family First prevention program here. And as all of us have experienced, this pandemic has caused us to rethink a whole lot of things in our lives. So with that, upon its ascending upon us, we were saddened to see the pandemic and its impact. And it's always tragic to talk about what has occurred, but every now and then we have to reflect and see what did we gain from this, and what benefit can we gain. And this pause has given us a benefit in a sense, because if we would have continued at the clip we were progressing, we would not have had the opportunity to step back and look at prevention in its totality and incorporate it into the Connecticut's plan. And what I mean by that is the pandemic illuminated a lot of areas that we would not have thought to put in our plan. This racial unrest that has come upon our nation occurred during this time of pause. The economic downturn that showed the disparities of income and economic security for a lot of people in our country. We would not have saw that unless this has occurred. We would not have had it illuminated as bright as it was unless this pause occurred. And so many other things that have happened during this time of pause, and it made us rethink about our plan that we were going to submit. Several jurisdictions, I think about 4 or 5 states, during this time of pause, during this time of pandemic, went forward and submitted a plan, and we read them all, and we could have easily did the same. We could have easily just continued and wrote and submitted a plan that would have gotten passed if we did, and would have been good. But we're not looking for good in Connecticut. We're looking for great. We're looking for excellent. And we want to take advantage of this opportunity that we have, this window that's open for us to be as inclusive and as transparent as possible so that we can be as impactful as possible. And so now, as we're talking about relaunching and restarting our efforts, we really want to go deep. We want to broaden prevention, not just from the front porch and front yard and front street and all those other things. We want to go much wider and assure that child maltreatment don't occur in Connecticut at the rate that we currently have. We want to really make a statement in the state of Connecticut as this being a catalyst that we're serious about eliminating child maltreatment. And we do that through aggressive and systematic prevention services that we can see can make a difference through its evidence. I mean, it just came out that this past year, Connecticut had one of the steepest declines in arrest and violent crimes. So we can do it in this state. We see that when we're focused on getting something done, it happens, and this is something we want to renew our efforts upon. So as we look at the global scan, I mean the national scan as it relates to Family First, we see a lot of jurisdictions are submitting plans that are good plans, as I mentioned before, and we can take some of the best from those and leave some stuff on the table. And we're going to do that. I think most folks are looking at their front doors and looking at, Caroline calls and things like that. And there's nothing out there that I can truthfully say is so remarkable that it just blew our socks off and said we want to go towards that. I mean, the pinnacle isn't there yet. That's who we're going to be. We think we have the ability, from all that we've done and the investments that we've made in our system thus far, we have the ability to create one outstanding prevention plan for the state of Connecticut that starts community by community, family by family, neighborhood by neighborhood, and then migrates into our systems. So I'm looking forward to what's going to come out of this. Along with that very kind of ambitious desire of what we're going to have, I'm also going to put on Ken and Joshanda the sense of urgency to get it done, because we want to get it done now, because we're itching to get started. And so you're going to feel from us a constant push to say, let's go, because now is the time to get it done. So with that, I thank you and look forward to this conversation today. Ken, I'll turn it back over to you.
Right. Well, thank you very much, Michael. And I'm aware a couple people have indicated they can't see the PowerPoint. We're not sure, we're having a little technical glitch, so we're gonna figure that out as we continue down this morning. So in preparing for today, Joshanda and I thought it would be a good idea for us to have a segment about lessons learned. What did we really experience the first time we were all together completing our Family First work? Boy, that was a little over 10 months ago on November 18th, 2019. We were all in the same room discussing the concept of Family First. That was our kickoff. Let me ask you a question. Has your life changed a little bit? Yep, absolutely it has. And now I see especially the PowerPoint's back, so that's great. I think all our lives have changed in the past 10 months. I want to give you a couple stories about that I think are really indicative of our work. The other day I was in walking around my neighborhood, and I was wearing a tie. I was walking our dog, and this little boy came up to me. He said, "Ken, what are you doing?" And I said, "Well, I went to work today, and I just got home." He said, "No, but what are you doing?" I said, "Well, I'm a social worker. I work with children and families." He says, "No, why are you wearing that tie? What are you doing?" And I said, "Well, typically when I go to work every day, this is how I look, but I don't think you've seen me like this because I've been doing a lot of work at home." And he looked at me and said, you deal with kids? You're working with kids?" I said, "Yeah." He said, "That's a really special thing that you do every day." And I said, "You know what, Avi, you're exactly right." And then I connect that thought to a quote I heard the other day when one of our racial justice consultants, Jen Agosti, spoke. The quote is, "Kassarian and Jerry, It's a Maasai warrior greeting, which means, how are the children? Jen told us a story about the fierce tribe that the Maasai warriors are, but they're fierce in the sense that they also protect their children. And so as I was thinking about our work today and the relaunch, I thought about how our lives have changed. I thought about how that little conversation I had with the young boy in my neighborhood informed me that our work is special. I think I can extend that to say that Michael Williams has said that our work is sacred. And when the Maasai warriors talk about how are the children, we have only had a laser focus to answer that question that's been enhanced by our Family First work so far. What have we done? We've had over 270 community partners that have joined with department staff to form our work groups. And I use the word partners very specifically and not providers. Partners include everybody across the system, our sister state agencies, yes, our contracted providers, our grassroots organizations, our advocates, our youth. And we've also brought families with lived experience to the table. We wanted all voices to be heard during this process. What did we do? We met regularly. In fact, some groups met weekly. Some groups met every other week. I think Joshanda and I probably put more miles on our car in those 3 to 4 months than we did the 3-4 months prior to that. What we also know is that we wanted to ensure when those voices were at the table that we empowered everybody to speak clearly. And we wanted to ensure that not only were your voices heard, but that you felt confident to speak from your perspective about where the barriers, the gaps, and the overlaps are in our system. We challenge ourselves to think differently. That work started to build what we call our Family First Prevention Plan, of which we decided that Connecticut was going to develop and look at all of our systems and all of the pathways under which families come to our attention, and to develop a statewide plan of support, of which Family First is a part. So that's a clarification point that we wanted to make today, that Family First is a tool as we are developing our overall plan of prevention for kids in the state of Connecticut. But what I think we saw, and one of the lessons that I certainly learned right away in our work, is that the values and the principles of Family First have already been embedded in so many ways across our communities and across our work. Think of the way that we engage with our families, even more so now in this remote environment where we're doing it virtually. Think of the circumstances where we are empowering families. Most of all, there's 2 thoughts that come into my mind when I think of the Family First principles and the values that are embedded when we collaborate. First of all, is the belief that children are best served in families, their own families. We believe that. We think you believe that, and we believe that children can remain safely at home without Department of Children and Families involvement, with the right services at the right time. And the second thought that's attached to that is the better we collaborate and the better we understand each other's thoughts and our words and the accents of our work, the better off our children and families are going to be. I think another lesson that we learned is we've been very transparent throughout the process. I've said before, and I wanted to reiterate today, that the Department of Children and Families is the Child Protective Services agency, but we're not the Child Protective Services system. When Michael talked about the pandemic illuminating parts of our work, I think this is a piece that really we want to keep in the forefront of our mind, is that we are the government, we are the entity where calls are received when a child is harmed. But all of us on this call today encompass the Child Protective Services system. And Family First speaks to the further development of a system of alternative pathways for our families and means in which support can be given to families much earlier. So the call to our care line can be the last call on a family and not the first call. Michael indicated, as well as the commissioner, boy, the pandemic, COVID-19. To me, it reinforced the importance of our collaborative efforts, but it also reinforced that because of the work we did with Family First and the development of the trust that we had in the mutual way that we looked at our systems, I think it's fair to say that all of our work during the pandemic was that much easier, and we were that much more effective for the children and families that we serve. But how does the pandemic connect to Family First? Well, what do we know? We know that originally when children were sent home from school, there was a significant problem. And that problem was that now, because children were not going to be seen, there was a belief that children would be harmed. But that belief also connected that parents wouldn't properly care for their children. But yet Family First is the opposite of that. The core belief of Family First is that parents with the right supports, with the right skills, with the right emphasis and efforts, will in fact do what is right for their children. So at first, our department was asked a lot of questions. What are you going to do? You're not getting reports. Are children going to be harmed? And our response was, we fundamentally believe in the power of the family, that a family can step up and take care of themselves, and with the right time and the right effort and the right supports, they will be okay. We also realized during the pandemic that the department never closed, but the nature of our work is what changed. We learned a lot of lessons. Families were so responsive, and to this day have been responsive to our remote and virtual work, our use of technology. Families actually report that they believe we're doing better social work with them, and our staff talk about feeling a greater sense of accomplishment because our conversations with families are not simply centered around abuse or neglect. It's also about, what supports do you need? How are you? What is your day like? And how are you doing? As we were moving through our COVID-19 pandemic, as Michael already stated, we were hit with significant social unrest in our communities. And it illuminated for us, once again, the disproportionate and disparate way families of color come to the attention of Child Protective Services. We are committed as a department to becoming an anti-racist organization, which will lead us to becoming a racially just organization. And the fact that the pandemic and the economic crisis and social unrest have all hit at the same time, to me means there's a greater meaning there. That as our Family First work started, and then it paused, and we had such unbelievable times in our communities, it simply reinforces that we need to be here today, and we need to relaunch for the betterment of our kids and families. And these occurrences, I think, also put us in a position to examine our beliefs. We should ask ourselves, are communities broken or are they bent? Dr. David Saunders gave a speech the other day, and that was a question he asked. How do we look at the communities from where our families come from? And are we embedding in those communities the supports that we need? Or do we feel that children there need to be rescued because their families and their communities are broken and without hope to change? Ask yourself whether or not the families in Connecticut need surveillance or do they need support? And I'm going to give you an example about that in a few moments. Do families need somebody knocking on their door and asking them, did you do this? Did you do that? Or do they need us, all of us, to ask, what do you need and how in fact can we help you? Connect that thought to, how do we view our parents? Are parents unwilling to provide care for their children? Or are they, due to circumstances beyond their control in a lot of ways, simply unable? And doesn't unable allow us to support them versus the unwilling looks at them to say, you must need surveillance. One of the greatest quotes I've heard during the pandemic that I wanted to share with you today is whether or not our work, and when I say our, it's our, everybody on this call, whether or not our work is to keep children safe from their parents or safe with their parents. That's a powerful question. Are we of the belief that families are doing the best they can with their children and need us to guide them? Or are we simply there waiting for them to make a mistake so we can jump in and rescue? And as I indicated before, when our family first work is rolled out and prevention is truly embedded in our communities and we are collaboratively working together, we're going to meet families where they're at. We're going to meet them sooner in the process. And even more so, the Department of Children and Families is going to be the last call instead of the first call. I wanted to leave you with a story that came to my attention during the week that I think really exemplifies where our system is, but also talks about where we want our system to go. And I'm going to talk about a school involvement with a family, not to cast aspersions on the school, not to cast aspersions on the police, but just to give you an example of how I think our family first values and our beliefs could really tie in. Back in April, our Norwalk office received a referral on a 10-year-old little girl. And the school was concerned because the little girl had not connected yet to remote learning. And they had called the house a number of times and the father had not returned the calls. And they described this little girl when she was in school as somewhat depressed. So what the school did, because they couldn't get a hold of the father, is they called the police and had the police go out and do a well child check to ensure that the child had not been harmed. Police reported back that the child lives with her aunt and her two cousins. Dad works, and at times it is difficult to get a hold of him. So the referral was made to our department. A worker named Martha Saavedra out of Norwalk took that referral, was able to maintain contact with Dad, and asked Dad, how can I be a support to you? And the answer was very simple, but also very telling of our entire system. Dad said, I work as a mason. At times I'm in a place where the reception's bad or my boss tells me to turn the phone off. I brought my daughter here from Honduras. My wife and two other children are in my native country. I'm doing the best I can. We don't have Wi-Fi in our apartment. We don't even have a computer. I want my daughter to learn. I just don't have what it takes to help her right now. So what did our worker do? She called the school. She went to pick up the Chromebook from the school. She met the father, and in the hallway of his apartment building, showed him and his 10-year-old daughter how to log on to the internet, how to get into her schoolwork, how to navigate virtually her education. The end result of that was a little 10-year-old girl who now is learning, is engaged in the classroom, a father who doesn't feel that a system wanted to conduct surveillance on him, but truly when he turned around, felt the support and the compassion and the engagement of our worker. If we take Manuel's story and realize that if we embed in our communities the family first principles of prevention and outreaching and looking at a family to say not what you haven't done, but what could we assist you to do more of so your family's in a better place? Now we've wrapped our children today and in the future with a series of supports that will be with them and change their lives for the rest of their life. What we also learned through our work, and in a minute we're going to transition this to my co-lead, Joshanda Gurrier. We've also learned in our work that all of us need to continue to collaborate very closely. We are so appreciative of the work that Sarah Lockery and Mike Halpin have done as our co-chairs of our statewide advisory council. And we believe that we want to empower that group and our regional advisory councils even more so. So you're going to hear in a little bit about our work group updates. We've made the decision that the community partnership work group, what we would like is instead of having a standard work group, we would like you to embed yourselves in the other existing work groups and then come back to the regional advisory councils and provide your input and your thoughts and your questions. And through the regional advisory council structure, we will have your questions and thoughts fed to the statewide advisory council, who then will report back to Joshanda and I your thoughts. So I bring that up now as a way of again saying We need to embed our work in as many different areas around the state as we can, with our SACs, with our RACs, with our advocacy groups. Think of Manuel and his story and his 10-year-old daughter. If she was in the room with us, if she was live on the camera today, I hope she'd be very proud of the work that we have accomplished and the insights that we have gained, and to know that we are all working so hard to get not just a Family First prevention plan completed, but to really look at all those systems and all those pathways that we have for our kids to make their lives better. So with all of that being said, I'd like to segue over and have my co-lead partner, Joshanda Gurrier, walk us through the facilitated conversations with our work groups and their accomplishments. Thank you.
All right, thank you, Ken. Good afternoon, everyone. We are so very excited to reinvigorate this work. In this next segment, you will get to hear from a few of our work group co-chairs, as well as from our consultancy partner, Chapin Hall. Together, we will be sharing with you the team's achievements to date, as well as our plans moving forward. If you have questions as we step through this, please do type your questions in the Q&A section of this live event. Ken will be monitoring to help us know when we may need to pause to respond to a question that is relevant to the discussion at the point. And then we also will look to compile the information that is included in the live event in a Q&A FAQ if we have enough content at the end. So Joanna, if we could, let's jump into the next slide, please. As one of the co-leads of the candidacy work group, I would like to share with you a few of the accomplishments that my team achieved under the co-leadership of my co-chair, Dr. Jeff Vandeploeg. He's the president and CEO of Child Health and Development Institute of Connecticut. At the beginning of this process, our team, we met weekly, as you heard Ken say a little bit earlier. We spent our winter actually, last year conducting a review of Connecticut's child and family data from various sources, such as the Careline, the CAPTA portal, as well as our family assessment response partners at UConn. By reviewing the data, the group really thought that it was a way for us to focus our attention on the youth and families that were currently being served by Connecticut. And that really helped us outline the requirement that we were tasked with in defining what Connecticut's candidacy population should be for the purposes of Family First. And so over a series of several meetings compiled of healthy discussions as well as considerations, we took into account things like an intentional focus on disproportionality. We looked at underserved populations, and we really kept in the forefront of mind, were we creating by default surveillance outcomes, much of which Ken talked on, because that absolutely was not what we wanted to do. Collectively as a group, as we comb through the need based on data as opposed to emotions, we were able to actually come up with a multi-pronged definition that was very inclusive of several vulnerable populations. And we were very purposefully broad in creating this expansive definition, because from the Deputy Commissioner's intro, he indicated that now is the time that Connecticut wants to have a prevention-focused system. So our work in the candidacy group allowed us to really be intentional about who we folded into that definition. So the first group in our definition includes all children as well as their families, because one of the benefits of Family First is it's not about just the child, it's also about the family, because if you're healing family systems, you have a greater opportunity to stop the need for them to continue the cycle of being served by DCF. And so anytime a call is accepted at the care line, whether that call is accepted for investigation purposes due to alleged abuse or neglect, or if it's a family that's reaching out to us that's requesting services through our voluntary care management program, or if for some reason they may have gone down the FAR track, the point is if we received a call at the care line, irrespective of what the disposition or outcome is, we thought it was important to create access to intervention for services for those families. So that's going to be the first prong of our multi-pronged definition. The next group that we included is, we know that sometimes there are kids who have siblings. And so those siblings may not be the subject of a DCF investigation. They might not be system involved, but because of the complexity of our work, we wanted to create access for intervention. Just because the mitigating circumstances that brought the one child into care might not have been such that it impacted the sibling just yet, if we're truly being preventative, we want to make sure that those services are available such that maybe that sibling never has to come into care. Permanency is something that we all work very diligently to achieve for our families. But what we don't want to do is shore them up, provide services, get them reunified or adopted or in guardianship, and then for some reason they need something else, we don't help them. So we intentionally included in our definition anyone who achieved any form of permanency in our system so that they can come back and get those interventive supports such that they don't need to be served by our system formally again. The next population was our pregnant and parenting youth in foster care group. This group was specifically called out in the federal legislation, so it was easy for us to roll it into our Connecticut specific definition. So those will be included. And the last composite group of our definition is probably the one that the work group was most excited about. If you kind of listen to the previous themes of those that were previously included, it really kind of had that DCF-centric touch to it. We said Caroline, we said involvement with FAR, we talked about siblings of kids involved in the system. Everything was really about those who we've touched already. But when you really think about the opportunity that we can create through leveraging Family First as this tool, it allows us to think more broadly than that. And so we wanted to touch what we refer to as our community pathways group. And this is our ability to work with families and children of those families who we already see have some concerns, as indicated by the data, when you start figuring out what are some of the challenges or what are some of the experiences that our families go through. And so this community pathways group will allow us to serve those populations proactively. They may be inclusive of children and family who may be unstably housed, as well as youth who are JJ involved. And so we want to get upstream and work with our juvenile review boards to work with kids at arrest, not necessarily at adjudication, because again, it's how soon can we touch them. Infants born substance exposed, we want to serve them as well as their mom. You know, we utilize our CAPTA portal to collect information and data. Just because the kid was born, sometimes they don't always become a subject of a report, but we want to make sure that we are being non-punitive and proactive in our intervention of services when creating our prevention system. So that was included in our group. We'll be working with children as well as caregivers who themselves may be experiencing a disability, or children or caregivers who have a mental illness, or maybe they have a substance use disorder. We thought that it was helpful to include that in our community pathways group. Any youth that may have been human trafficked. We're also looking to work with families of kids who have incarcerated parents, children who are chronically absent and truant from educational programs. The idea and the goal with this community pathways group is really to get our arms around them before we ever receive a child welfare knock at the door, or they receive a child welfare knock at the door, or a call to the care line for whatever future allegation that may actually occur. So, you know, thinking about what we've accomplished, it's a lot. We're excited. Our definition is robust, but we think that it is important as long as we move forward to kind of talk about future state. So as we jump into our next steps, I just want to talk to you a little bit about that broader vision that you've heard the Deputy Commissioner mention. You've heard Ken now talk about that broader prevention. That is very important to us. A lot of people talk about Family First from the standpoint of it's the solution, and it is a tool for us because the actual funds, which we'll touch on fiscal a little bit later, it's narrow in terms of the specific definition that I just went to around our candidate specific population, but we want to be really solution focused and really innovative in using that to enhance and broaden that broader prevention. And so what I really didn't touch on is that broader prevention lens outside of what Family First will reimburse us for, but that broader just further extends our ability to touch families through this no wrong door approach. So when you think about us leveraging Family First as a tool, and you think about the work that we need to do going forward, technically our candidacy work group as we know it, we've completed our task. We have a definition. It was blessed by our governance committee in January of this year. We were very excited. But from there, we really took a step back and realized that there is some capacity building work that we now need to do. And so from that capacity building work, we need to figure out. So now that we know the who, and you'll hear a little bit more about the what from our service array group here shortly, the how do you access that information is what we're trying to build. So when we realized there was more work for us to do, we affectionately referred to our candidacy group as Candidacy 2.0. Some of our members agreed to stay with us as we started to build that infrastructure work. But what we realized is the continued use of that term candidacy is probably confusing, if you will, the focus of the work. So to mitigate the confusion and to create consistency between the actual work that we're going to be doing going forward, we're going to actually rebrand ourselves. So after today, candidacy we can consider is done. We have that definition. We're now going to refer to ourselves as the Prevention Infrastructure and Practices Work Group, because really that's what we're doing. We're really starting to pivot to look at what do we need to create in terms of access. Is it community-based? Ideally, I would say yes. Is it a combination of that DCF centric group that we mentioned and the community-based? What are the assessment tools that we need to use to make sure that we are making sure that folks are eligible for the program, but also that we are assessing and evaluating their needs to get them to the right service timely? What is the data that we need to continue to collect around this particular work? We anticipate that there will be some IT needs that we need to build to capture this new design and new system as we move forward. So you hear a lot of themes as it relates to infrastructure. And I'm pausing here because it looks like the volume is lost. Are you all able to hear me, Joanna?
We can hear you, Joshonda. Yep.
Perfect. Fantastic. So infrastructure is where we will pivot to. And from there, we will then get into making a recommendation as a group to governance. Ken will talk about what governance means, but ideally it just means that there isn't just one group in a vacuum making decisions. This really is a collective body, collective spirit as we move forward. After we make that recommendation, we will then pivot to looking at other work specific to policy and practice alignment, looking at any potential procurement needs that may arise as a result of the various work groups. We'll take that on through this infrastructure group as well. And so I just want to pause for a minute to ask Ken, did any questions come in specific to candidacy that we should address?
You know, there's two questions, and let's see if they fall right in there. The first one is, does this work also incorporate homeless young adults?
So homeless young adults is one of the groups that we talked about, absolutely. And we thought by being a little more broad, by saying unstably housed, that would encompass more folks. So if you got granular, then we got into the conversation about, well, which definition do you use, McKinsey-Vento versus HUD, etc. So the short answer is yes. But what I want you to hear me say is the intentionality of being inclusive by using the unstably housed. Okay. A couple other questions now are populating the chat. Is there a timeline consideration or age for the youth who achieve permanency?
I'm thinking about a young mother, say 21, who was in care as a youth and is now a mother attending a community-based program receiving parenting support. DCF's not involved with the family. Is that mother a candidate, and therefore the program should be eligible for reimbursement if they are? So again, the scenario is it's a mom who was in our care, I'm assuming, and had achieved permanency. She's now a mom herself and who has a child and is attending a community-based program. Because she was previously in care, would the community-based program that she's receiving to support her own child be something that could possibly result in federal reimbursement? Interesting question.
So what I would say is that's a complex question that the answer could be maybe. But an easier way to look at that is to consider, does the child fit into one of our candidacy populations when you look at it from the framing of our community pathways group? Because ideally, while Family First does support families, the nexus is the child. The federal funds are specific to child-specific plans, which then create intervention plans for the family. So while mom was previously in care, mom is at that age now where she's not in that pool of eligible folks for us. But now that mom is a mom, then it is likely that we would be able to serve the family through the child-specific plan attached to her child, which we would then be able to reimburse the services received by the mom. So I know that was a little convoluted and complex, but when we start to think through the technical pieces of what this practice and infrastructure looks like, those are the types of things that we have to iron out to be very concrete and specific about when it's reimbursable and when it's not, and then how do we track it in the right plan for CQI purposes to be able to do the administrative claimings on the back end. So all of that work that is required for reporting, ideally the family shouldn't experience any of that. That should be back office functions that we build so that they know that they show up, they express the need, we support that need, and then the claiming pieces that you're referring to should be seamless.
Great. So one quick one, actually there's two. One I think we'll get to at the end about how this plan takes a look at the no wrong door and how it encompasses those other conversations such as the Children's Behavioral Health Plan, implementation plan that we have in existence. I think the last question, Joshana, for candidacy is, when considering working with families proactively, such as children with incarcerated parents, has it been taken into consideration to work proactively with families and youth who identify as LGBTQ? What do you think? So
what I think is yes, we had that conversation. And so as we figured out what goes in the smaller Family First specific bucket, and that is really for funding. So when we say Family First specific, that's that list of individuals or population groups that I referred to. Those are the ones that we would actually be able to request Title IV-E reimbursement for, specifically mapped to an evidence-based service that's in our prevention plan. We ended up including the LGBTQ population in our broader prevention definition, which that is posted on our website. Under our candidacy group, it is literally a page long, so I don't have it in front of me, but that's one of several other groups that we're serving under the broader prevention lens. So when we say broader prevention lens, what we're talking about is as we use Family First to serve the smaller group that I referenced, we hope that we will be able to shift some of those expenditures that we're spending on those populations into the broader system, such as LGBTQ, to be able to create service continuums to support them. So we did not include them, we just included them in the broader series of other populations that we will support differently.
Awesome. And so again, as a reminder to everybody, we will also be writing up FAQs based on the questions that are being asked today, whether we actually answer them here or we can't get to them. So I think that probably completes the candidacy questions. A theme in the question and answer have been, are we going to share our slides? Absolutely, we'll put them up today on our website, and I'll talk a little bit about that before we close out. So Joshana, I think we're probably good.
Thank you for that, Ken. Next, I'd like to introduce you to Tina Jefferson, Bureau Chief for Child Welfare for DCF. As one of the co-leads for the Kinship and Foster Care Group, Tina will share highlights for the group's accomplishments achieved to date. This group was co-led by Mrs. Randy Rubin Rodriguez, who is the co-founder and executive director of Our Kids Family Center. Tina?
Hi, thank you, Jashonda. So it couldn't be a better time than today to relaunch our Family First work because September is Kinship Care Month. And nationally, more than 2.7 million youth live with relatives. In Connecticut, we currently have 3,997 youth in care, with 44.3% of them currently living with relatives or people that they know. With your help, our goal will be to achieve 70% of our kids living with kin or people they know. So for our Kinship and Foster Care Work Group, where did we leave off in March? We had a meeting scheduled for 3/13 actually, and COVID hit. So we canceled that meeting. And by the time we canceled that meeting though, we were on course to meet our work group goals and key deliverables. So we had already identified and assessed barriers to children living with relatives or kin. We had recommended ways to address and mitigate the identified barriers and support relatives and kin. We identified strategies to engage relatives and kin better, both inside and outside of DCF. We had identified strategies to increase children's placement with kin, and we had identified many key components of a Kinship Navigator program. Move to the next slide, please. So when we talk about next steps, with the increased support from Chapin Hall, we feel like, we only need a few more meetings for our Kinship work group to. The first would be to finish our recommendations related to training to ensure we have well-prepared kin. And then secondly, we want to make sure that we reconcile and refine all of our work group recommendations, which we believe can be accomplished by the end of the year. So going back to the deputy commissioner's call, I believe our work group can wrap up quickly, Michael. And then together, we will develop a Connecticut model of kinship navigation that will align with our values, our vision, and a new and improved DCF practice model for working with kin families, both inside and outside of our system. Thanks, Jashonda.
Thank you, Tina. Ken, any comments or questions in the chat for Kinship and Foster Care?
Not at this point. Again, we will be sharing the FAQs and the slides on our website. Tina, I think you said something at the beginning of your presentation that maybe I could ask that you could reiterate. When we decided to stop our Family First work due to the nature of the pandemic, at that point, you were really one meeting away, I believe, from wrapping up your work, if I heard you correctly.
Two, Ken. So one meeting would have been, again, to focus on getting recommendations around training. And then the final meeting was really to pull all of the recommendations together from the launch in November all the way through March. And so we had another sort of final meeting planned around April, and then our work group would have been done. So we do believe that we can get those things accomplished by the end of this year.
Got it. Okay, because I think that's important for the work group members to know is how advanced your work was, and really how expeditiously you were able to complete things. So what you see here as far as the next step are some big lifts, but yet you got there due to all the work and the build-up here. I don't think there's any. It doesn't look like there are any other specific questions for your group.
All right, thank you so much, Tina. Now you will hear from Elizabeth Duryea. She's the DCF Division Director of Systems and Organizational Development. Elizabeth co-chairs the Program and Service Array Work Group with Dr. Elizabeth Kanata, Vice President of Community-Based Family Services and Practice Innovation with Wheeler Clinic. Elizabeth?
Thanks, Joshonda. So I'm like everyone who has presented so far, very excited to have this work relaunching, and I'm happy to offer an update on behalf of my co-chair, Dr. Kanata. I would also just like to thank the members for our Program and Service Array Work Group. We were 70 plus strong going into the COVID crisis. Have had some engagement in the past couple of weeks of people as people have been asking questions about what some next steps are. So we will be quickly following up today's phone call to move this work forward. As Tina shared, the work going into COVID was very close to being on target to meet the deliverable with our initial charge of providing recommendations for programs and services that should be included with the candidacy plan. And I wanted to take a few minutes to just call out from some of the accomplishments presented on this slide, you know, the work that we did leading into COVID and give sort of a status update with respect to where we are now, and then how we intend to build off the momentum that we had going into March, but seek to regain in the coming weeks. So our work group began really at the end of 2019, the last quarter of 2019. And as I referenced, we had a lot of engagement with providers. We had a lot of engagement with other partners for our work group, and it truly was a work group. We as co-chairs, I think Elizabeth and I were very invested in creating interactive meeting structures so that folks felt that they were really, you know, giving their voice to the work, helping to guide what was planning from meeting to meeting. And I don't think we would have been as far along but for having such an engaged group of members. So excited to build on the momentum there. Where we really began and is outlined on the slide was we wanted to, we had a little bit of a downtime while we were waiting for the recommendations for the candidacy definition. So we didn't want to lose that time. And we really felt that there would be benefit to conducting a mapping of Connecticut's current service array. And we called this the continuum of services that are intended to strengthen and support families. And while we will go into this in a lot more detail to just sort of recap for the work group at our work group's first meeting, which is on October 8th, we wanted to begin with that mapping because we knew once we had the definitions of candidacy from the work that Joshonda and her team led, that we could begin to align the programs and services that we had in Connecticut under those definitions, and also identify where there are some gaps. And that would allow for us to pull in some of the expertise from Chapin Hall and looking at some of the other plans that had been approved from other states to see where we might have gaps in services. Are there programs and services and specifically models that meet the threshold of empirical support, which means has the threshold evidence base for consideration under the candidacy plan for any state? So the aligning of the service from that first bullet sort of broke down Connecticut's continuum of services, and those were services broadly across the state. Those weren't services that were limited to DCF or even another state agency. Those could be community services, and really then trying to align those under the three domains of Families First. And those included parenting, mental health, and substance use. And we had a lot of insights from both Chapin Hall, but also the Families First Clearinghouse around what had already been approved. And so a lot of the mapping was intended to align the services that we had in Connecticut's continuum, identify those gaps, and then as we got the definitions of candidacy that had been approved, we were able to really, you know, further refine what the services we had in Connecticut were, where there were gaps, and then also begin to identify which models had that level of empirical support to meet the candidacy requirement for submission for that plan when we got to that point, which is where the group is really going to be picking up some of that work, and we will benefit from technical assistance from Chapin Hall to help ensure that we have the most current information to reflect where models have been approved since March and what models may not necessarily have a level of empirical support to meet the candidacy threshold, and not to lose that insight, not to lose those models, because that's where we know our starting point will be for Connecticut's broader prevention plan. So we are excited to go into more detail with members next week, and I think as outlined on the slide, we are very close to having finalized recommendations based on the work that was done leading into March, and I believe we were somewhere about 2 to 3 meetings out before we would have those recommendations. We're seeking to have our work group on a timeline to have those finalized recommendations to governance by December 2020, and we do think that that's very doable given all of the work that's been done. And then we also know that it's going to give us a really good starting point as we pivot our work group from the candidacy plan recommendations to digging into what are the broader recommendations around prevention. And Johanna, if you could flip to the next slide, please. Thank you. So the first 3 bullets are really intended to guide the next work group meeting. I also want to acknowledge, as outlined on the call today, that we are going to be welcoming new members. And so hopefully, as some folks are seeking to join one of the work groups, the program and service area work group has been, a very interactive work group with a lot of active participation from partners across the spectrum in Connecticut. Our deliverable is really this. We are really seeking to put forth recommendations for a candidacy plan to reflect that our investments align with our investments in programs and services, I should say, align with our values and what we want for Connecticut families. And I think part of that will be, dealing with some of the technical mechanics of Families First under the candidacy definitions, but also seeing the broader opportunity through Connecticut's prevention plan, where we really know that we can have a positive impact in hopefully averting families from coming to the attention or to the door of child welfare. So with that, just wrapping up on this slide, we will offer an orientation session for new members so that we can walk you through what has been our journey for our work group in arriving at the work that we will be building on going into October. We will also spend some time discussing the outstanding questions around the services where we're still trying to determine empirical levels of support, recognizing that for the candidacy plan, we will need to be guided by the research base for models. But then we will also have the opportunity to retain all of that mapping and all of those insights to guide our prevention planning. So excited to kick that work off. I'm really happy to answer any questions. And again, thank you to all of our work group members for your patience. And we look forward to regaining the momentum that we lost since COVID hit in March.
Thank you, Elizabeth. We do have actually 2 questions now that just popped up. Can we get a copy of the continuum of services mapping? And Joshanda responded already to that person, but I think it's a good point for all of us. It is currently a work in progress, correct? And once completed and approved by governance, it'll be ready for sharing. Does that make sense, Elizabeth?
Correct.
Okay. And this one, what time is the meeting for the programs and services group next week, and how do we join? That's a really good question that's gonna come up.
So just to give a shout out for our work group, our first relaunch meeting post-COVID will be on October 8th at 1:30. It will be 90 minutes. We're looking to convene those on a bi-weekly basis. And if you are interested, I think Ken, you or Joshanda are going to cover how folks may seek to join those work groups, and that the invites will go out from the Families First email address.
Great. Let's see. Will the work group look at gaps in services for our impoverished neighbors?
Absolutely. I think that a couple of comments on the call already today reflect where we are post-COVID. What are the needs of our families and what are the needs in our community? And really resounding and repeat theme for our work group has been a need to focus on basic needs, including housing, food security, access to health and other community services. And while we know we are a little bit limited with the candidacy plan itself as that first submission, we know that there is an opportunity through the broader prevention plan and then all of the overarching work underway at DCF in collaboration with our partners to think about what is this prevention umbrella that we are building across the state. And so very much basic needs services will be part of that. And also recognizing that we may learn from the submissions of other states where they might be a little bit further along. So definitely leveraging that as we pivot into 2021, I think that will have to be a huge focus.
And so Elizabeth, one of the questions that I hear in my conversations with people, both internally and externally, is we don't feel there's enough evidence-based programs for the department to utilize. So the frame of that question is, we know that under Family First, when our prevention plan is submitted and approved, when we have evidence-based services in that plan that have been approved by the clearinghouse, the department may be subject to reimbursement for the expenditures for those programs. But the department will maintain also funding non-evidence-based programs because we recognize there are unique needs of families in our communities. Can you expand on that thought a little bit and to help others fully understand that evidence-based is the priority, but there's just not enough evidence-based to go around for all the unique needs of our families?
Yeah, it is a technical question, and it's one that I think is important to reiterate and bring back to these conversations on an ongoing basis, because it can be very confusing. And so we know in the world of evidence-based programs that we have models that have eligibility criteria, and sometimes the existence of eligibility criteria can be a limiting factor for families to get access to those services. And over the work over the department over time, I think, has really been not only recognizing the value that investing in evidence-based programs has, but I would say calling out where we've seen much more of an investment as we've shifted away from an over-reliance on congregate settings and residential settings to community-based programs, and specifically in-home services that are not predicated on, removing kids. And so what are the services that we can put in place, and some of which maybe, have a very high level of empirical support, so have gone through an evaluation. But some of them may be much more grassroots and just programs and services in the community that we know are a lighter touch, are easier for people to manage. They don't necessarily have, the more rigid criteria for people to access those services, but the continuum needs both. And it does require a constant evaluation and conversation about, do we have the right suite of services, recognizing that for Families First, for this candidacy plan, the federal government has determined that they want to see, that plan focus on programs and services that have some empirical level of support, very well supported through an evaluation. The opportunity we have is really through the broader, if you think of the candidacy plan, and we have a graphic in one of our slides, and I think we've used it in a number of these conversations, the candidacy plan is the small circle, the prevention plan is the big circle, and the opportunity to really, take and build on what is the concept of prevention, how we are defining it as a state, and that's not just about DCF. We know that's about everyone who has a nexus to serving kids and families here in Connecticut, but that broader prevention plan is where we will have a lot more flexibility and opportunity. And as you referenced, and I'm sure that Cindy Butterfield will speak to this, when we know a service is working and when we know that it's a service that our family needs, we figure out a way to fund it. And so Families First is, as Jeshonda mentioned, is a tool. It's a fiscal tool. It's a fiscal lever that allows for us to generate some revenue back to the state, which is always good from a fiscal stewardship standpoint as a large state agency with our budget. But we also have our other budget to work with. So we really want to make sure that whatever it is we are, funding in the way of programs and services is, serving families well, and really reflective of the values that we bring to this work.
So the chat is being populated now, the more we're talking. So we're getting some momentum. So why don't we try to answer a couple more of these questions. Yes, we are looking at services inclusive of youth with specialized needs, right? Is more being done to collaborate with contracted providers to enhance their engagement with fathers? That is work that's ongoing, certainly with the department, and not necessarily have a direct link to Family First. Here's an interesting question. How much are you working with other agencies or branches around program and service array delivery? For example, CSSD around programs for their kids who are currently under their jurisdiction, but wouldn't have to be if prevention or diversion programs were available. Interesting question.
It is, and I know, Ken, it's work that many folks within the department have some nexus to. I would say by virtue of the broad definitions of candidacy that have been approved by governance, we know that there's a JJ pathway in there. So very much that will require looking at what are the services for kids who we see now winding up in JJ. How can we, how can we approach collaboration with the courts through CSSD? How can we really think about really narrowing the funnel by which a child would wind up with formal JJ involvement, if not for having had, some level of preventative or supportive service on the front end?
Got it. We have, and there's one follow-up question. It's probably best to have handled in fiscal, so we'll queue that up when Cindy goes. So I think that, let me just double check here. I think we're good as far as the questions.
Thank you, guys.
Thank you, Elizabeth. Our newest group, Intensive Treatment 24/7, convened to build the qualified residential treatment program components of our system. This work is being led by Dr. Linda Dixon, DCF Administrator for Adolescent and Transitional Services, and Mrs. Alicia Gaduti, President and CEO of Edelbrook Behavioral and Developmental Services, Inc. Linda will share with you the accomplishments and visions of this work group. Linda?
Thank you. Hi, everyone. I have the good fortune of working with Alicia Gaduti and a team of 50 vibrant members. So Families First outlines specific requirements related to the staffing and certain processes in our residential treatment settings. So we met in early spring, and we met again last week. We plan to circle back together at the end of this month, actually the end of October. We have set up 4 different time-limited task forces that will meet once or twice in October. We have a list of deliverables, and there will be no delay in meeting those. We completed a survey of our providers regarding the QRTP requirements, and we were able to crosswalk those requirements with our scopes of service. We've drafted a certification process, and that's going to be one of the 4 task forces that we've set up. The task forces are in aftercare certification, 60-day review processes, and a family engagement with associated workforce development task force. We've been connecting with our point person at ACF for our questions and been pulling examples from other jurisdictions around the country. We're moving towards firming up our recommendations and building on the lessons learned during the COVID crisis. So as we work together as a team, we've been honoring the vision that QRTPs are efficient treatment settings that offer pathways to live in family homes. And we understand that QRTPs should operate with an urgent and comprehensive focus on family engagement with strong linkages to schools and broader community resources. So as I've been doing this work with my Vibrant team members, we've been having a lot of conversations, and I couldn't help but see that this has fit quite well with all the other work that we've been doing across the state with our various stakeholders. And my lens, of course, is on the adolescent side of the house. And as we move towards firming up a consolidated practice model that serves transitional age youth, that goodness of fit has been on my mind. Families First references transitional age youth throughout, and our emerging practice model is heavily influenced by an ecological perspective and by a positive youth development framework. So we know that the integration of family, school, and community efforts is a bedrock principle in ecological models. Well, QRTPs are supposed to have that strong link with family and broader community resources. And true to positive youth development framework, our hope is that QRTPs will rely on strengths-based approaches to support skill development, build a sense of mastery and self-confidence, and connect youth to positive adult resources in their families and communities. So we look forward to the opportunities ahead. We guarantee we will meet our deadlines, and we look forward to getting together in October.
All right.
All right, those are some very firm and strong commitments, Linda. You're throwing down the gauntlet and letting the Deputy Commissioner know that you will be ready. So thank you for that. Fiscal and revenue enhancement, the group that many are very curious about, is led by Cindy Butterfield, DCF Chief Fiscal Officer, and Dr. Allison Blake, Chief Executive Officer of Child and Family Agency for Southeastern Connecticut. Cindy will be updating us on the progress of the group to date. Cindy?
Hi, everyone. I'm very fortunate to share this chair position with Allison Blake. And we've been working on our revenue enhancement and fiscal report. Up to this date, we've pretty much been laying the land and trying to figure out what our maintenance of effort is. We have gotten some expert consultation on that, and we're bringing those, we're bringing the figures from 2014. You know, when I close a fiscal year, I hope never to go back to it, but I have had to reopen that one back up and see exactly where we were. And we've found that, you know, we had some programming back then that did meet the maintenance of effort. I wouldn't say a huge portion of that, but we were kind of on the road to Families First kind of programming back then, which means that we would need to increase those kinds of investments. And then our goals moving forward are to take what the work products are from the other groups, meld them together and start doing some fiscal modeling to see where we are at the best fiscal advantage. So I want to emphasize that our work is the last in the relay race. So I appreciate that Linda says she's going to come in on time. It'd take a little pressure off me if she was late, but now I'm going to have to, I'm not going to have any excuses. So we're going to take the candidacy pool. We're going to match it against the fiscal kind of models for reimbursement to see how we might be able to fund our programs and what revenue sources there would be to be able to do that. And we'll probably look at a couple of different approaches with our team and try to come up with the best one. What I do want to say is I think there's been quite a bit of concern about us only going with evidence-based programs, and Elizabeth hit upon that we will have a group of things. We're looking for the best plan we can come up with for the kids and the families that we serve, and we hope to not lose revenue. We realize that this is a different kind of model, and we're not looking to bring in a lot more revenue. If that happens, that would be great, but I think it may be a little unrealistic. We're looking to not have a decrease in revenue and match up as much as we can to the plans that folks want. So that is our goal of our committee. It's a little abstract until you actually start to lay out the cost of those those kinds of programs and the revenue potential. And we are also not just looking at Families First as we do that. We'll look at our regular revenue sources like TANF and Medicaid, if that's applicable for these, because Families First is the payer of last resort. So that's where we stand. We will look forward to getting our assignments from the other teams, and I'm going to try and make our deadline. I'm not as bold as Linda Dixon is, but I'm going to try and make our deadline.
We may have deadline wars up here in central office, Cindy. We do have a question for you, possibly two. Just wanted to go back. We need to seriously look at contracting barriers, reporting requirements, etc., that are not covered in cost and fee for services. Can you answer that a little bit, or answer part of that?
I think the question comes from asking us to look at our fee-for-service rates and determine if they're adequate to meet the service delivery. If that's the case, certainly we can take a look at that and see how we arrived at those rates and what our cost plan was.
Okay. The second question may be connected to you a little bit. I think Joshonda, you may have answered it as well. How are we coordinating with other state agencies regarding other federal initiatives, such as the SUD and high-end small CK grant awards? Is that more of a program issue, Joshonda, or is that a fiscal?
It's a combination, but we're trying to tackle it more programmatically initially. We know that there are great opportunities with the SUD waiver being one mechanism of us being able to funnel some services under Medicaid payment. Timing is one of the challenges that we've experienced. So, we was originally on this Family First timeline of getting done 2 days from now. Now we're pushing out almost at next week. Michael is in my head. Next year. But SUD is on a slightly different timeline. So trying to figure out how to be mindful that those bodies of work are occurring and integrating where there's opportunity to move the work forward. We're always on the forefront of thought and having those conversations. The grant is new, and I think that there is great promise with what that grant has to offer. So we will continue to have those conversations in partnership and internally to figure that out. One good thing about Family First, by way of what's in our plan is we're trying to get our initial plan done by the deadline that we've already expressed. However, as we learn more and begin to assess our system, if we need to make amendments to our plan, there is an opportunity on the back end to do that. So I think as we figure out where those different programs end up, or where we see that maybe we missed some intersection points, we can always go back and make modifications to move us forward. So yes, it is fiscally connected, but I don't really think Cindy can do anything money-wise until we figure out programmatically where it flows and makes the most sense.
Great. So a couple questions I think that relate perhaps back to QRTP and to Cindy and maybe even Elizabeth's group is, as a guardian ad litem, one of the challenges I've witnessed is the limited supports emotionally, housing, medically, and financially for youth. How will these be addressed? So I think that to take an initial stab at that, and then Elizabeth or Cindy, if you want to join in, I think that's a challenge of our system for as long as we've known our system. The right services at the right time for our youth. So what is happening as we are looking at the pathways for prevention and the manner in which families come to the attention or do not of our department, we're also using this opportunity to look at gaps, as we talked about, but also overlays in our system. And that's going to mean, in some avenues, right sizing, more over here, less over here. And I think it's a good question that we are always striving to determine what our kids need the most right now and who is best to provide that. And so certainly being a guardian ad litem, you're referring to youth that are in the care and custody of the department. I think that when Joshonda and I commenced the Family First work, we were under a different fiscal blueprint and outlook than we are now 10 months later. Certainly the pandemic, the financial insecurity are going to cause the department to look very closely at our budgets, at our contracting process, and the priority service provision for our youth and families. That being said, Cindy or Elizabeth, did you want to jump in there? And then we have one other quick question about QRTP. Anything else there?
I think, I'm sorry, Elizabeth, if I stepped on you.
I'm good. Go ahead.
Okay. I think as we look at what's available and what we're doing to the system with these new programs and the new candidacy, it will push us to look at every single program and the mechanism for funding for it, and and the revenue source. So you have to look at the entire system to see where you might be able to move things, what's the payer of last resort, and what might make sense to move to a different section. When you're doing that, we'll of course look at the needs that are unmet and see if there's a way we can get those to be met needs and what sources might be available for that. I think we have to really kind of drill down on every piece of program, because we do have caps in certain areas of revenue to determine where we're going to go with that. That's more on once the program decision's been made. So those are the ways you've kind of you attack the problem when you're trying to come up with the best answer. And I'll turn it over to Elizabeth.
I would just add on top of what Cindy offered that part of the service mapping has really illuminated where we do already see some gaps. And, you know, again, with the opportunity that the prevention plan allows for us to think about, you know, proactively when we identify gaps, really thinking about with the dollars that we do have, where can we invest in those programs and services that we see really helping to meet those needs identified where gaps have presented. And I know a couple of areas that have been, in addition to basic needs, you know, I think really being clear that there's always more work to do, especially now in the post-COVID world around helping families meet their basic needs. Housing has been a recurring theme. The needs for families who need services for developmentally disabled children and youth. Another area is services for children and youth who have been trafficked. And we know that there are pockets of promising programs and again, services in the community, but we really have to kind of get underneath all of that. And as Cindy said, you know, where we as a large state agency with a budget of our size, we have an $800 million budget. We've generated a lot of credibility and goodwill with OPM and the legislature because we do a really good job of generating revenue back to the general fund. And to a certain degree, that gives us a little bit of insulation from rescissions, but it's not perfect. And we really do need to be strategic about where we are investing state dollars and not just funding the same services that we, you know, contracted for going back many, many years. But I think that that's where the benefit of the shifts that the shifts away in our practice, shifting away from over-reliance on congregate, investing in community-based programs, investing in in-home services, that's a reflection of the ongoing collaboration with the provider network, you know, as we've sought to make investment in services that keep kids in their communities and with their families. So in many respects, and I think this is a broken record for many of us at the department's practice has shifted in ways that I think puts us ahead of many other states with their families first planning, which is really exciting to talk about.
You know, Elizabeth, some really, really good points. And one piece I want to go back to is when you talk about the identification of gaps and who is best to provide the service in that gap. I think there's a couple examples of that. And so I wanted to preface what I'm going to say by, you know, really reminding people this is about system transformation, not just what DCF's going to do. This is about, and, you know, connecting that back to the story of Manuel and his 10-year-old daughter. DCF did a whole heck of a lot, but when our system is up and running, it's going to mean all of us are doing the work in a different way than we are today. But to talk about filling the gaps, during the pandemic, the department actually stood up 2 really important programs that have shifted the way in which we're doing our work. One is voluntary care management, where families who are now seeking voluntary services have their work administered and overseen by Beacon Health. And the other one is the Intensive Family Care and Support, IFCS program, whereby if a family has an unsubstantiated case, yet there are risk factors identified by the department and service needs that are unmet, that case would be transferred for ongoing case management services through the IFCS program, also overseen by Beacon. So it's those programs that I think, as we roll out our Family First work, we're going to be giving more back to the community, and hopefully earlier to the community, and not have so much work being done by the Child Protective Services Agency when there's families in need of support versus in need of a Child Protective Services intervention. So when I hear gaps, I immediately go to those couple programs that we've already set up.
I agree, and I would just add that, as Jeshonda mentioned, the procurement decisions, how do we take this information and allow for that to guide and inform the procurement process as those decisions are made? So I think it's an opportunity for us to close that loop in a much more, data-driven and community-informed way.
Great. A couple other questions. Maybe this is more of a Cindy. Is there a chance for Medicaid expansion to include additional in-home services?
I love Medicaid, so I would hope so, but that is a partnership with DSS, and we have to, look at meeting all those things. Ideally for DCF, that is the best prevention model, because folks don't have to come to us or be on the caseload to be able to get those services. So, that is something we, depending upon the services that are picked out, we would try to pursue. Nothing is off the table. We're going to look at every opportunity to see where we could bring this.
And one further question, we appreciate that response, Cindy. The recipients of the prevention efforts are adult caretakers. Do any next steps involve systems that service adults? So this falls right into our collaborative work with sister state agencies who are with the table at us from DEMIS and DSS and DDS and OPM, the State Department of Education, Office of Early Childhood. Not only have we been collaborating with those sister state agencies since our Family First work, that collaboration started very early in the tenure of Commissioner Durantis. In fact, when the department completed our Child and Family Services Plan, we actually had letters of commitment from, I believe, over 11 sister state agencies that they were going to work cooperatively with us. So again, this is about systems change. This is about the state of Connecticut transforming the way that we provide supports to families. And while the Department of Children and Families is leading that effort, the effort fails without the collaboration of our partners, as I indicated when I spoke a while ago, starting with our sister state agencies, our community partners, those we provide contracts to, and everybody along the system. So Jeshonda, do you have any other thoughts on sister state agencies?
Not particularly. I just would reiterate, as goes back to the probation question earlier about how are we engaging them. And the reality is we have been very proactive in trying to recruit all of our sister agencies to include CSSD. I know this question is about adults, which would be aging, but we want everyone around the table. We want for us to be able to think a little more broadly and collaboratively about the work that we are doing. So I think you touched upon it well, Ken, but just know that DCF is not working to do this plan in a vacuum with just us. If you've noticed in all of our transitional introductions, our co-chairs are partnership between internal and external. And so we want to make sure that our providers are at the table, we are embracing our state agencies, and then we have the DCF and persons with lived experience voice. So
one maybe last question for programs. I'm hoping there will be programs that focus on the need for behavioral health for parents and children experiencing stress, anxiety, and depression during the pandemic. It's essential, especially for families stressed and serving as teachers and parents while also trying to maintain their home and work schedule. So I think that to me is an interesting question when I read it, because the department does fund numerous community-based programs throughout the state of Connecticut. This is also, I think, a great example of there are behavioral health programs for parents and children who are experiencing a wide range of issues that never have to come to the attention of the department. And one of the initiatives the department set up during the pandemic was our Talk It Out CT campaign, where you could call the number, you could actually speak to a live individual to receive some support during these very difficult times. So I think that question really gets to the heart of something that Joshanda mentioned earlier. So when we develop our pathways for families to receive support, wouldn't it be great if we had a 1-888 parental support line, where if that person who you're talking about in the chat is stressed or is anxious or is depressed, the thought isn't to call the Department of Children and Families, it's to call this number where you can receive an array of services according to your unique needs. But the other side of that is we as a community also need to embrace that parent will know what to do and what's right for their family. And again, not understand that they may need surveillance, they certainly need support. So Joshan, I think that would be it for now. It looks like maybe one additional piece here. What about accessing additional waiver programs participation, or does that fall under Medicaid expansion? I'm a better social worker than I am a fiscal analysis. Cindy, can you take a shot at that?
I'm sorry, Ken, can you repeat the question again?
Yeah, I'll read it to you. It says, what about accessing additional waiver programs participation, or does that fall under Medicaid expansion?
There's various waiver programs. We do have DSS representation on the fiscal and revenue team, so we're certainly going to look at that, and we're staffed well to do that. I can't specifically say if it's an expansion. If there's waivers out there, then maybe not that we can apply for that. But really, I got to tell you that the world of Medicaid, I laugh about it, I say I love it. Well, I love it most because they do it and I don't, is very complex. And when I start to think I know the rules, I find out quickly I don't. There's another rule. So, we'll look at all those options, and we do have expertise on our team. So we can certainly take a look at those things.
all right, thank you, Cindy. Before I turn it back over to Ken to discuss governance, I'd like to take a moment to thank and acknowledge Mr. Tim Marshall, DCF Director of Community Mental Health, as well as Mr. Beresford Wilson, our Executive Director of Favor Inc., a parent organization. Tim and Beresford were the mighty leaders of the community partnerships and youth engagement group that we referenced earlier, and they are in support of this more intimate approach of their team members joining other groups. But I would be remiss if I did not take a moment to acknowledge all the efforts and hard work that those two gentlemen put forth in carrying our community group to the point it is to date. So thank you both. Ken, if you'd like to take over to step us through the governance process, that would be great.
All right, super. So we are rolling right along. As far as the governance committee is concerned, we had one meeting of our governance group, and the point of this committee is to take the recommendations that were made from the individual work group co-chairs, and then talk as a diverse group and ultimately provide a recommendation to the commissioner on the outcome of that recommendation. So basically what that means is that we know there's significant work being done throughout our work groups. We wanted a body that was made up of a cross-section of sister state agencies, providers, youth, individuals with lived experience, community partners, and DCF staff to then be that place where the recommendations that the co-chairs made could be discussed, could be sent back for additional information, but ultimately be that body that would then recommend to the commissioner, who has the ultimate decision on what recommendations are made to our prevention plan to be made. So again, we only had one meeting because we were moving along the continuum of recommendations, in fact, being finalized. And due to the pandemic, as we said, we paused on our work. So what we're going to plan to do is start at the end of October and meet monthly as a governance group, because as our groups now are wrapping up with their deliverables, we need to ensure a very consistent meeting cadence to make decisions, request additional information, as certain work group decisions will build upon others. So the candidacy definitions then allow the programs and service array group to be informed, which then has a nexus to kinship, which then has a nexus to certainly QRTP. And ultimately, when the recommendations are made and approved, now our fiscal group is charged with determining how all the financial pieces fit in. So again, governance is met once. We will establish a monthly meeting cadence very soon. We will advise the co-chairs of those dates and expected times when they can come, in fact, to discuss their deliverables. As all of our work groups will have their meeting minutes posted, any materials posted on our website. All of the work we do is certainly transparent, and we want you to be as involved in possible in that. I don't see any questions about governance. The only question I have is how can we help spread the word for the focus groups, connecting with legal aid and smaller grassroots agencies would provide access to families that are undocumented. I think that's a good point. I think Joshonda is going to initially respond to that, but we can also hold that for later on because that question probably encompasses a number of groups. So Joshonda, I think that being said, we have facilitated the work throughout all of the work groups, and prior to that explained how we would like the community partnership members to assimilate into other groups. So I think it's time for our partners at Chapin Hall to have the floor and discuss their work, and we are so pleased to have with us Miranda Lynch from Chapin Hall. Miranda, how are you?
I'm good. Good afternoon, everyone. Yes, I'm Miranda Lynch. I am a policy fellow at Chapin Hall at the University of Chicago, and I'm thrilled to be continuing to partner with Connecticut as they try to use Family First as a tool for their larger system transformation. It really has been clear to us, the point that I think everyone has heard emphasized over and over again, that Connecticut has a broader vision for transformation and a clear idea of how they want to serve families so that they're supporting them to be healthy and thriving and intact. And that really aligns with our organization's strategic goals, and we are very happy to support that. So Chapin Hall is a policy and research institute. We have as our goal bringing the research to the policymakers, pulling out the actionable insights, figuring out strategies and tools that help decision makers act on those insights and apply it into their practice in support of improving the outcomes for children and families. The vast majority of our work is in the prevention and child welfare space, but we also do work in early childhood and homeless youth as well. We have had the good fortune of working with jurisdictions all across the country as they are leveraging Family First as a tool for their work. We were able to work with the District of Columbia, Maryland, and Kentucky on their prevention plans, which are all approved. We have another partnership with Illinois, who recently submitted a prevention plan. And we're working with many other states in some stage of planning and implementation around the prevention provisions, the residential and placement and QRTP provisions, and kinship navigation. And what that allows us to do is in real time understand how other jurisdictions are grappling with some of the same issues. We can kind of compare contexts that those other jurisdictions have and draw out the insights from them and apply them in our dialogue and support of Connecticut as you are moving forward in your Family First planning. So I think we can go on to the next slide. Thank you. So really, you will see myself and my colleague Olivia Wilkes in governance committee meetings, in work group meetings. We might sometimes be very much in the background. We are there really to support the leads and the work groups to figure out their strategies to working through all the discussion items that you've raised today. So one of the things that we are kind of doing in the background is supporting work planning, actually coming up with a strategy for how you can move through this work, how you can kind of appropriately sequence the various decisions, the various elements of work, and inform each other along the way as you're doing it. So what you end up with is a very integrated plan that has the right resources to support it moving forward. So what this graphic does is a very high level timeline that takes us through the next 6 months and beyond. We're excited to be here at the kind of re-kickoff and re-engagement stage and really get back to the work of the work groups to reflect on all that we've done and reinforce the ways forward. And you heard from the team leads about some of those next steps that will be immediate in the next couple of months. These arrows kind of represent, I don't want to say endpoints, maybe delivery points, right? So we are expecting that the work on intensive 24/7 treatment and QRTP will be wrapping up around February. We are expecting that the next major element of work will be around the service array. You heard earlier that there's a lot of the recommendations that will be offered in the next couple of months around service array. And so what we have to do once we actually have those recommendations about what services will be selected for the prevention plan in particular is work out some of the details that follow on from that. If you're familiar at all with the federal requirements around Family First, you know that there's a lot of requirements in terms of continuous quality improvement and potentially evaluation. So you need the services information first, and then you can outline your particular strategies for learning on a continuous basis, whether those services are having the intended impact, if you have the right implementation supports to ensure that they're actually getting out to the community as you intend them to. We are also expecting that at that point, we're going to have a good handle on the prevention infrastructure and practices. So you heard earlier that there has been some decisions around candidacy already, and that Connecticut's vision is to be very inclusive. And with that, we want to rethink, what does the infrastructure look like? What are our workers doing? What are community partners doing with our families to actually make that a reality? So we don't want to continue just doing the same things that we have been doing. If we really want to ensure that children and families are being served in a different way, in a preventative way, so that they really don't have to come into the system, that suggests that we really have to do something different in the way that we interact with them. So what are the concrete structures of reaching out to families that we need, that are welcoming, that don't increase surveillance, that make sure that they get the services that they need, that also meet the federal requirements to the extent that we need to do that for candidates in particular, but really how are we aligning our system so that it really meets the needs of the population that we are most interested in serving. So really, the next 6 months is figuring out concretely what it is we are trying to accomplish with the prevention plan and with that foster care plan that also has to be submitted to the federal government, and then doing the work to actually describe that so it's clear to Connecticut and its community, and it's clear to the federal government as well what it is you tend to do and how you intend to utilize federal dollars in support of your overall goals. So we are really confident that we'll be able to have a really clear and impactful plan that is ready for submission to the federal government by April 2021. But the work isn't done. Once you actually write up the plan and submit it to the federal government, you do have some of the work of negotiating, perhaps, with the federal government, the actual contents of those plans, making refinements beyond April. But more importantly, you're going to get into the heart of the work of implementation, right? So really shoring up your fiscal strategies so that you're able to support the service array that you have. Really thinking about how do we get to a place where we're scaling up the services that we have said that we want in our prevention plan, and providing the right kind of resources so that you have qualified staff, so that you're actually moving forward with your infrastructure, you're adjusting all your policies and practices to do all the things that you committed to doing. So we want to make sure we have a very clear implementation plan and strategy, and that we're monitoring on an ongoing basis how we're doing and learning from it and putting it back into the work for adjustments. And then a final piece here is also working on the kinship navigation model. Tina talked about that earlier, that they're at a point where the kinship work group has kind of worked through a lot of their recommendations and is ready to work on standing up a model of kinship navigation. So we're looking to support that work and help Connecticut to build the evidence for a Connecticut model that's going to really work to support relatives and ensure that they are able to take care of children in their care outside of the system or with the support of the system. So those are some key points in the timeline that I wanted to highlight for you today.
Miranda, thank you so much. And Miranda has spent so much time in Connecticut. She's wearing Connecticut blue now. She's one of us now. She's one of us. Can't go back. Can't go back. Miranda, we appreciate all of your efforts, and I don't necessarily see anything in the chat right now specifically pertaining to your work, but something that you did say, if I could have you reiterate that. You know, that the initial plan will be submitted, but then plans are updated, they're revised, and they're changed. Can you talk a little bit about why they would and what that process would be?
Yeah, there's a couple of reasons why states would update their plans. The federal government has complete flexibility in terms of when you can update your plan. So that offers states some opportunities to think about this work in phases. It may be the case that the end goal and transformation that you want to achieve needs to be accomplished in phases. So you may have a plan that kind of meets you where you are, but know that you want to get to a plan that is bolder, grander in design. So you could submit a prevention plan that kind of starts at the first phase, and then as you are able to kind of work more to redesign your infrastructure, that you're then resubmitting your plan to be able to accomplish more things. The other thing that's important here to keep in mind with regard to the prevention plan specifically is that the federal government is identifying those services that meet the evidentiary requirements, and they're doing so rather slowly. They are not moving at a pace that I think we would all want. So it is the case that there's a rather limited number of interventions that are approved from the federal government's perspective at this moment, and those are the only ones that you can include in your plan for federal funding. So it may be the case that 3 months down the road, 6 months down the road, 2 years from now, there's a different set of interventions that align with what Connecticut's population needs, and you want to amend your plan so that you can include that in your offerings and have the opportunity to be reimbursed for them.
Great. Miranda, thank you for that clarification. And
Sure.
again, it emphasizes the point that our submission of the plan is the first part of Family First, but then there's the implementation. And even as implementation is occurring, additional programs are going to be approved. There's going to be tweaks in our system. We may realize that we were going in a direction one way with a candidacy group and now want to include or refine that. So basically what I'm trying to say is this is always going to be a work in progress. So for those individuals who are out here and looking at a potential candidacy group or something else, nothing is final yet. And the more we collaborate and get together, the better. Great. So I think that concludes our segment with Chapin Hall. Thank you very much. I think the next piece here, and actually the last PowerPoint piece here, was that we were going to talk a little bit about how do I get involved. And so it's very simple. And at the same time, I think there's some interesting information that we would like you to know about our work. So first and foremost, everybody who is on this call today receives our monthly Spotlight on What's Right newsletter. We send that out monthly. Actually, it's coming out this afternoon, where we highlight the really positive things that are occurring within the department, stories about our collaborative efforts with partners and providers. And it's really geared towards celebrating the successes of our children and families when all of us work together. So you receive those. You also receive what we call our daily newsletters when we write about a particular service or a topic or a happening that we think not just our DCF staff should know, but also our listserv of over 700 community partners. So please continue to look for information from us. At times, Commissioner Durantis will write a memo specifically to our community partners. At times during the pandemic, she has written correspondence directly to contracted providers as it pertains to particular aspects of our work. So please look for those. And if you're not getting those newsletters, check your spam folders, because at times, certainly they go into that. We also encourage you to take a look at our general website for our policies, our procedures, the statutes that govern our agency, information on everything from definitions of child abuse and neglect to the services that we have, to the work that Joshanda's group does, to our domestic minor sex trafficking trainings, and everything in between. Our website is very advanced, and we want you to understand fully what's there. All of what we are doing in regards to Family First is on our website. And you see on the screen in front of you, and again, we're going to post all of these PowerPoints later today. Our Family First website has all of the information we've talked about, from PowerPoints to videos. Today is being videotaped, so we'll put that up there. It also has per work group the minutes and from each work group, the agendas, any documents that those work groups have considered in making their decisions. And we're going to post the active work group meetings and provide you, we believe, a link to the video virtual meeting, so you know right then and there what time your work group is meeting. You can lock that into your schedule, and the information will flow very clearly. And again, anything we've talked about, anything we've done is right there. What we also want to do is we would encourage you to ask us questions at the Family First email address, dcfctfamilyfirst@ct.gov, dcfctfamilyfirst@ct.gov. We respond to everybody's email that comes in. Any question you have about today, moving forward, a particular group, if you have documents that you think would be helpful for us to take a look at, absolutely. We want to hear from you. We want to hear from you about how today went. We want to hear from you on what you would like from us as far as overall communication moving forward. Joshanda and I have spoken that we are very committed to posting on our website FAQs. We're also committed to providing you on a consistent schedule, perhaps a Family First quick newsletter about what's happening and the most recent state of occurrences. So you can bring that information to the groups and the individuals, in fact, that you meet with. We also think it would be important for you to spend some time on our COVID-19 website. Really proud of my staff in the Bureau of External Affairs who have put together this website. And you see the address there, and you can also access it by our general website. When you come to the top page of our general website, you'll see COVID-19 planning. If you click on that, we have a whole array of links for services for families. Families who are trying to access supports for housing, food, virtual support groups, family activities, and certainly information on substance use and intimate partner violence. What I could tell you is, since the pandemic has started, we have had over 20,656, I'm not counting, but I am, 20,656 unique people that have gone on that website to access the services that we've posted that are in the community, that are not funded by the department, but we've put them together as supports for families. You will also be able to see all of the correspondence between the commissioner and our staff and our private community partners regarding COVID-19, visitation, information on the contracting process, wearing PPE. And I think when you spend some time looking at those correspondences, you'll really get the understanding of how fluid our work has been, that the agency has always remained working, we never closed, and the manner in which we have striven to take all accounts and communicate as clearly as possible with our staff. Lastly, on that COVID-19 site, and I'm starting to smile as I say this, is you will see Commissioner Vanessa Durantis and her weekly videos to our staff that we do. Every one of them, they are there, and let me tell you, we have so much fun every week doing these, and at some point we may give you the best of bloopers. Lastly, oh no, she's saying oh no, right? She's still muted, so you couldn't hear that. And lastly, the other way that you can remain involved is we have on the screen there our COVID-19 dedicated mailbox. If you have specific questions related to our COVID-19 work, by all means email us. Everybody gets an individual response. So really the point here is we're closing, and then we're going to ask the commissioner to provide us some closing remarks. Really the theme throughout the day is we are so proud of the collaborative efforts that we've undertaken over the past 10 months. We're also proud of the work we have been able to do as a system. Let's stay involved. Let's get re-energized. Let's relaunch, as we did today, our Family First work. We want you to ask us questions, provide us information, check out the websites. We are committed to making not just a solid, excellent Family First prevention plan for the state of Connecticut, but committed to really systems change and systems transformation. So we have a true prevention system in the state of Connecticut where Child Protective Services in our agency will be the last call and not the first call. Any outstanding questions in the chat, we will get them back to you. So with that being said, on behalf of Joshanda, Gurrier, and myself, it has really been such an honor and a pleasure to be with all of you this afternoon. And Commissioner, take it away.
Commissioner, before you take it away, Ken, I just want to jump in real quick because there are at least 2 key fiscal questions that popped up in the chat that I think may be at the forefront of thought for some people that may be helpful for Cindy to verbally step through. Both of them may be in one answer, because part of this is I believe that there are still some thoughts universally that there's a pot of money that comes along with Family First. And there is no pot of money. Family First is a 4E reimbursement mechanism to support specific interventions to specific candidate populations. But Cindy, if you want to make that more fiscally minded in vernacular, maybe we can help the group fully understand the 2 questions that we received specific to that.
Thank you, Joshanda. Cindy's still with us. Cindy, can you hear us? I think she may be replying to somebody and writing in the post. But if Cindy is still there and can hear us, could you jump back on? Okay.
All right.
All right.
Well, with no Cindy, I think what you tried to suggest, Ken, is correct. We'll put it in our FAQ as a follow-up.
Here we go.
Tina just asked if you still have a probate question, Ken. Is that?
Yeah, I think we can handle that in the FAQs. Yes.
Great.
Thank you, Tina.
Thank you. I defer. Thank you, Commissioner.
No problem. Thank you. Thank you definitely to Joshanda and to Ken and all of our co-leads, to Chapin Hall, our consultants, to the exec team and the leadership across the department, and to all of you who have taken the time this afternoon to listen to all the work that has been done across these subcommittees. There was a lot of information shared today, and even more information that has been shared in those individual subcommittees, because what we know to be true is that this work never stops. And pandemic notwithstanding, the people who are committed to improving conditions for the lives of children in Connecticut will step up and step into the crisis. So thank you, thank you, thank you to all of you. This is a relaunch, but is by no means indicative of any less commitment that we have to this work. What you heard today is an opportunity to pay attention to racial, cultural inequalities, pay attention to access, pay attention to need, pay attention to what can happen outside of a child protection system, what can happen outside of the judicial and court system. You know, we want to make Connecticut a place for children and communities to thrive. And we recognize that we have all of the underpinnings to be able to make that happen, and to make sure that our system across our 3 branches of government, inclusive of other sister state agencies, and all of you across the lifespan that begins with healthy children can collaborate and broaden the focus of how do we contribute to making sure children and the well-being of Connecticut's children across the state will thrive. We appreciate your time this afternoon. We know that we have much work to do. We've done a lot, but not nearly as much as we need to do in order to make sure that children and families get what they need. And I'll leave you today with something you heard earlier today, and that is when Governor Lamont asked me, Vanessa, how are the children? I want to be able to say, Governor, all the children are well. So thank you again for your time this afternoon, recognizing that all of our time in the virtual environment is very precious. We ended a little bit early today, and I'm sure all of you can think of some other things that you want to do aside from being in front of a computer monitor. And so our gift to you from DCF is to give you some of that time back. And again, many, many, many thanks. Let's get to work.
Thank you, everybody.